I'm Diane Smith. I travel all over this state looking for the people who give Connecticut its character and heart and tradition. And I found all those qualities right here. The people at Visiting Nurse and Hospice of Fairfield County have been bringing healing and comfort to the community for nearly 90 years. Aaron Gaberman loves baseball.
I cannot resist playing it at all, even if I'm sick or I have to go through cancer or something.
So when Aaron was diagnosed with 2 brain tumors on his 10th birthday, he needed a winning team to get him through it.
When they told me that I had cancer, the first thing I thought was that I'm gonna die. Because I've heard all these stories about people dying from cancer, and I was like, are you serious?
There were many difficult decisions to make about Aaron's treatment, but one was easy for his mom, Terry. She chose Visiting Nurse and Hospice of Fairfield County to help him get well.
They were the first phone call I made before I left that hospital with Aaron. We needed a qualified, compassionate team that was going to be ready for us when we came home.
Visiting Nurse and Hospice of Fairfield County provided everything from assistance in administering Aaron's medications, counseling to help his family, even respite care when Terry needed to get out of the house for something as simple as running errands.
Never give up.
They became our cheerleaders. They were our nurses. They were our caregivers. They just became our best friends.
We're there 24 hours a day, 7 days a week, 365 days a year. Whatever an individual or family might need in terms of our services, our nurses, our home health aides, our therapists, we are there. We are there for them.
Terry Gaberman had served on the agency's board of directors, but when her own son needed help, she really came to appreciate Visiting Nurse and Hospice of Fairfield County.
Yes, this is an agency that everyone can benefit from the very young to the very old.
Yeah, and how are you doing? How's your headaches? No headache.
Claire Jospé has benefited from those services for 13 years.
I have somebody to call. I have somebody to depend upon. Somebody who would take care of me no matter what, forever.
Claire ran a very successful real estate agency, taking pleasure in finding the right house for each client. For Claire and her husband Henry Opalak, this spacious house in Westport is exactly where they want to be.
I have no intentions of going to a convalescent home or anything.
Claire and Henry are able to remain in their home because of their team from Visiting Nurse and Hospice of Fairfield County, headed by Nurse Fran Buno.
We lend a guiding hand to allow them to stay in their own home and to be independent as long as possible.
Did you hear the one about the Halloween party?
No, I didn't.
Oh gosh, you know, we're just very, very good friends. More than just a nurse and patient. She's always there when I need her. She's very strict with me so that I stay healthy.
Fran has seen the couple through a variety of health issues over the years. She not only monitors their conditions, she communicates with their doctors and their children.
You really have to look at the whole picture. You know, you don't come in with tunnel vision and just say, oh, I'm a nurse, I'm going to check the blood pressure. You have to look at how someone is functioning in their home. When you have 2 elderly patients that can't get out, who's doing their grocery shopping? Is there food in the house? Is there adequate support, especially when you have children that live out of town?
Physical therapist Denise Cantor works with Claire on her strength and balance.
You're looking at them in the setting where they have to live and function every day. So you can really cater to their needs more.
Recently, when Claire suffered several personal losses, social worker Marcy Link joined her team from Visiting Nurse and Hospice of Fairfield County.
The people that come to see us, they're all fantastic. They really are. They're like family.
Claire and Henry have state-of-the-art technology assisting in keeping them healthy and safe at home. Between visits from their nurse Fran, they have interactive checkups with nurse Tammy McGovern via home telehealth.
Hi Claire, how are you?
Okay, sweetheart, you look terrific today. I love your hair now.
It's a simple computer system, interactive audio video. where a patient in their home can see and hear our nurse in the office. The nurse in the office can see and hear that patient at home. It's a real-time, interactive audio-video interchange.
Sounds great, Claire.
With home telehealth, Tammy can remotely check Claire's oxygen levels and listen to her heart and lungs.
And it's in addition to the visits that we provide in the home.
I thought it was one of the best things since the invention of the wheel. But it really is. It's mind-boggling what they can do with it.
They feel empowered. And it's not only just the patient, but also the caregivers, the home health aides. They can check their blood pressure and they can call me, and I can assess the patient right over telehealth.
During one of those telehealth visits, Tammy found Claire had a very slow heart rate. After a call to Fran and a call to Claire's doctor, Tammy called the ambulance from her office.
The following day, Fran came to me and she said, "Tammy, you saved her life. You really did. You saved her life." And that was like the greatest feeling, to know that. And then to know that I still have my Claire.
Visiting Nurse and Hospice of Fairfield County is always ready to give care and comfort, even at the end of life.
This is when Ron started Yale Divinity School back in 1993.
Gail Halverson says her husband Ron saw life as an adventure.
They got a real kick out of seeing their dad graduate.
Showing the diploma.
Showing his proud diploma.
Yes.
He had a great business career, and then late in life at 49 he went to Yale Divinity School, and that's when his passion to be with people in all stages of life really came to the forefront.
Ron Halverson became an interfaith minister for Visiting Nurse and Hospice of Fairfield County, even counseling families as he battled cancer himself.
And I think his illness made him even more real. So they knew that he was walking the same path that they were if they were ill. When he could get a family on hospice to share stories and celebrate a life, he was truly happy.
We look to provide care in the final months, weeks, and hours of an individual's life, and do that in a way that is the most respectful and most comfortable for that individual and for their family.
I have a wonderful collaborative team, spiritual workers, social worker, volunteer coordinator, home health aides, homemakers, grief and bereavement counselors. We all work together to fulfill that need.
In Gail's words, hospice nurse Dee Dee Locke brought peace and calm to the Halverson family in the last days of Ron's life.
We really like them to not focus on the disease, but focus on the person, and having more memories with them, going over memories of their lives together, and also closure with that loved one. And although the hospital was excellent, it's just such a cold, sterile setting. You can't get comfortable. So to be in our home and to have everything in place and to have friends come in and out and family just to be here, I can't imagine doing it any differently. It was as good as an end could be.
At all stages of life, whether a person is recovering from an illness, needs long-term care, or is at the end of life, the caregivers at Visiting Nurse and Hospice of Fairfield County are there, making a difference. The agency offers health and wellness to all through community education programs, vaccination clinics, health screenings, and school nursing.
We never turn anyone away. With the support of the community, grantors, donors, volunteer members of the community, we are able to deliver our care to people 24 hours a day, 7 days a week.
Visiting Nurse and Hospice of Fairfield County, bringing healing and comfort to the community for nearly 90 years. For 13 years, Fran Buno has been Claire Jospé's lifeline and the key to Claire's independence at home.
It's not so bad, yeah. And how are you doing? How's your breathing?
I don't know what we should do without her. I don't know how we would replace a person like that. It's impossible.
As a nurse for Visiting Nurse and Hospice of Fairfield County, Fran has seen Claire and her husband Henry Opalak through a number of serious illnesses.
We lend a guiding hand to allow them to stay in their own home and to be independent as long as possible.
Claire and Henry have no intention of leaving their Westport home, and thanks to the team of caregivers that Fran has put together, they won't have to.
She cares, and she checks up, and she would come every day if I needed her.
But Fran doesn't need to be there every day. Claire and Henry have state-of-the-art technology assisting in keeping them healthy and safe at home. Between visits from their nurse Fran, they have interactive checkups with nurse Tammy McGovern via home telehealth.
Hi, Claire. How are you?
Okay, sweetheart. You look terrific today. I love your hair now.
With home telehealth, Tammy can remotely check Claire's oxygen levels and listen to her heart and lungs.
Sounds great, Claire. Lungs are nice and clear.
The compact computer system lets the nurse and patient see and talk to each other in real time. A blood pressure cuff and stethoscope allow Tammy to detect changes in Claire's condition. The small camera even allows a nurse to monitor wound care.
I thought it was one of the best things since the invention of the wheel. But it really is. It's mind-boggling what they can do with it.
Even for patients who aren't computer savvy, the technology is simple to learn and user-friendly.
There's just a few steps that they have to take, a few buttons they have to push, and the information is transferred over here into the office. And they find it kind of cool when I call them up and say, you know, your blood pressure's a little high, or your blood pressure's good today.
Agency President and CEO Sharon Bradley says home telehealth means positive, proven outcomes for patients.
Our nurses can pick up something at a moment's notice. A subtle change in blood pressure, a subtle change in heart rate, a subtle change in lung sounds that we can identify, then communicate with that patient's physician, make changes in that patient's medication or treatment right then and there, has done wonders to keep patients at home and out of the hospital and keep them in a good, healthy place.
Or send them to the hospital in an emergency. Although Claire had no symptoms, during one of their telehealth visits, Tammy found she had a very slow heart rate. After a call to Fran and a call to Claire's doctor, Tammy called the ambulance from her office.
The following day, Fran came to me and she said, Tammy, you saved her life. You really did. You saved her life. And that was like the greatest feeling to know that. And then to know that I still have my Claire.
Home telehealth. One more way that Visiting Nurse and Hospice of Fairfield County provides care and compassion in the comfort of home.